Why does bipolar medication take so long to work? Imagine trying to fix a complex machine with many moving parts. That's similar to how bipolar medications work in the brain. These medications, especially mood stabilizers, need time to do their job. The reason is that they influence brain chemistry and neural pathways gradually, not instantly. When you start a new medication, it takes several weeks for noticeable changes to happen. One key reason is neurochemical adjustment. Mood stabilizers like lithium or anticonvulsants work by changing how neurotransmitters like dopamine, serotonin, and glutamate are released and how they interact with receptors in the brain. These changes are slow because the brain needs time to adapt to the new chemical environment. It's like slowly tuning an instrument so it sounds just right. Another factor is the complex mechanisms involved in bipolar disorder. The condition affects multiple brain systems and signaling pathways. For example, mood stabilizers help calm overactive pathways and reduce excitotoxicity, which is when nerve cells get overstimulated. Normalizing these processes takes time because the brain needs to restore balance across different systems. Dosing also plays a role. Many medications requiring careful titration to reach the right level in your blood. For example, lithium needs to be monitored closely because too high a dose can be toxic, but too low might not be effective. Doctors gradually increase the dose over weeks to find that sweet spot, which naturally delays the full effect. Symptom variability adds to the complexity. Bipolar disorder symptoms can swing between mania and depression, and sometimes multiple medications are used together to target different aspects. Finding the right combination and dose can take time, as each person responds differently. Even after you start feeling better, medication often needs to be continued long-term. The goal is to prevent future episodes and maintain stability, which requires consistent use over months or even years. The effects of medication are cumulative, building up gradually to sustain mood stability. Most people might notice some small improvements within the first week or two, but real stabilization usually takes several weeks of steady medication use. During this period, healthcare providers may add other drugs to help manage symptoms while waiting for the mood stabilizer to reach its full effect. Because bipolar disorder is a complex and chronic condition, patience is essential. Working closely with your healthcare team helps ensure the medication is safe and effective. Sudden stopping or irregular use can lead to relapse or withdrawal symptoms, so ongoing professional guidance is vital. In summary, bipolar medications take time because they need to slowly correct intricate brain imbalances, requiring careful dose adjustments, and depend on the brain's ability to adapt. This gradual process is normal and part of effective treatment. Remember, always consult your healthcare provider for personalized advice and support on managing bipolar disorder safely.